Hey, it's Drew. I'm 23 years old today, and I am 7 months minus 1 day on T, and got just a few things still subtly changing based on the T as far as getting more body hair. My face is still incredibly oily. But other than that, nothing as glaring as it was in the first couple months, which, hey, I mean, life has settled down. I'm just about finished with a written exam that is essentially the master's thesis for the graduate program that I'm in, which then I will enter PhD candidacy. So that's a big deal and very stressful. I haven't really been able to work out because of it, and I've been very tired, and I'm pretty sure 95% of what I've had in the last 4 days has been Gatorated coffee. So getting that out of the way would be great. That's 4 days from now. Other than that, I've been passing really consistently, and for the most part, it doesn't faze me. I'm really, really comfortable with it. It's just I go on with life. Every so often, it kind of puzzles me. I had a student refer to one of my old roommates as a male with male pronouns, and in teaching, I don't generally come out to my students. It's not relevant, and I feel like for most people it would be a distraction, so I just kind of leave it under the table. I'm sure if somebody were to ask, I would just outright tell them, because that's pointless to lie about it. But it was kind of puzzling to me because, I mean, my roommates, they've all been female. I lived in single-gendered housing when I lived on campus in undergrad. That's just kind of the way things have been, so it was just kind of shocking, I suppose, that all of a sudden people are assuming that my past is necessarily male, when it wasn't. And the other really big thing that I've had going on is that I had a consult with Dr. Buckley in Minneapolis. In May, I had a consult with Dr. Tholen, and it went really well. He's a great surgeon. His office staff was wonderful. They were very comfortable with me being trans. They were just very nice people. Dr. Buckley, unlike Dr. Tholen, works in the University of Minnesota hospital, essentially. And as such, her staff is not just her staff, it's staff for several other doctors that also specialize in plastic surgery or oncology. There were a couple other different surgery specialties in this area. So when I dealt with this surgery staff, they were completely clueless, downright idiotic, and kind of funny for me at this point. If this had been 4 or 5 months ago, had I been earlier on T, I would have been pretty pissed off. They probably would have botched things up even worse than they did. When I called to make the consult appointment, the receptionist person that I was talking to, when they found out that I was getting female to male chest reconstruction surgery, they stopped listening when I said female, and then assumed that because I sounded male, that I must be going to be female, like, in the future, and they started calling me ma'am, and I'm legally male, my name has been changed, I don't look female, I pass all the time, like, it's not a question. So that was just aggravating, like, people not actually thinking about what's going on. And then the nurses in the office, again, still clueless. And after the phone conversation that I had, I decided that, even if I tell these people, these medical professionals, exactly what's going on, they will be just as clueless, because they just don't understand. And it's not my job to explain it to them. I could if I really wanted to. But instead, it's just more humorous for me to let them stay clueless. The first nurse that I encountered asked what I was there for. I said that I was having a consult for chest reconstruction surgery. She asked if it was an accident, and I said no. She asked if it was a defect, and I said yes. She asked if it was congenital. I said, yeah, kind of. But I was getting pretty aggravated, and my voice tone just kind of messing with her in general. We did eventually get around to addressing what medicines I'm on, and I explained that I'm on testosterone. She asked if I injected it, and was completely scandalized by this. I don't know if I looked too young to be capable of injecting myself with something, but at any rate, she was pretty clueless. Continued to call me Drew, continued to call me he. When I say that they continued to call me Drew, I say that because they might have access to my old records that have Elizabeth on them, but they would have to look. They should not call me anything other than Drew. If they were, that would be a problem. But the second nurse that I dealt with was also really clueless, and when I was said that I was having chest reconstruction surgery, and she was having me sign forms and regarding using my pictures of me in educational presentations and everything, she then asked if I was there for breast implants. Really. And that, I laughed. I outright laughed, and it was you're a ridiculous idiot kind of laugh, and then I told her, I'm like, no, I want them off. She did not come back into the room after that. Dr. Buckley came in and brought in another nurse, who she explained that she wanted that nurse in there if it was okay with me, just so that she could become more familiar with trans people. That was just fine. Both that nurse and Dr. Buckley were very knowledgeable, were very comfortable with me, understood what me being a trans guy meant, and also engaged me in dialogue to where I was able to explain what was going on, and it didn't result in them calling me ma'am or asking if I want breast implants. They knew what was going on, but by and large, the hospital staff there are a pretty big bunch of idiots. So we'll see. I'm thinking about my surgery choice again, and that is all that's going on in my life. I'm really stressed out, but I don't know. The effects of tea are still really, really encouraging. Today's my 23rd birthday, and last year, on my 22nd birthday, I was really uncertain about transitioning and how I saw myself, and just like whether or not I wanted to be male. And I told myself on my birthday that if I really wanted to be male, like, this was my day. If there was any day to just do what I wanted, this was it. And so for the day, privately, I just thought of myself as a guy and just kind of let myself relax in that. And it was comforting, but at the same time very daunting to see, okay, I still look like this. I know that I'm comfortable seeing myself as a guy, much more comfortable, but I still look like this. And to see myself in the mirror now and remember that is awesome, and makes this a pretty great birthday. So I'm going to go out to dinner, and I will talk to you guys later.